Physician-assisted suicide generally refers to a practice in which the physician provides the patient with a lethal dose of medication upon the patient's request, which the patient intends to use to end his or her own life. In Oregon, it is reported that 100% of cases of physician-assisted suicide is due to loss of autonomy, or not being able to care for oneself and make one's own decisions. Also in Oregon, 80% says it is related to a loss of dignity and a loss of being able to participate in the enjoyable activities.
During the past 60 years, there has been a remarkable increase in the percentage of people who believe a physician should be allowed to administer euthanasia at the request of the patient and their family.
Ruth Gallade from Eugene, who supports physician-assisted suicide, protests in front of the Supreme Court Wednesday, October 5, 2005 in Washington. The Supreme Court revisited the emotionally charged issue of physician-assisted suicide and attested the federal government's power to block doctors from helping terminally ill patients.
Bishop John Shelby Spong says, "The right to a good death is a basic human freedom. The Supreme Court's decision to uphold aid in dying allows us to view and act on death as a dignified moral and godly choice for those suffering with terminal illnesses." Many ancient Greeks and Romans preferred voluntary death over endless agony. This form of euthanasia was an everyday reality, and many physicians actually gave their patients the poison for which they were asked.
If things get bad at the end, I'm racked with pain and can't feed myself, got tubes and stuff coming out of me, I don't want that to be her last thoughts and visions of me either.
In the early 1990s, concerned citizens formed Oregon Death with Dignity to write and pass a law that would allow dying patients to control their own end-of-life care. In 1994, Oregonians voted to support Measure 16, the Oregon Death with Dignity Act. Should a person be able to decide when they die? Does it matter if a person is a child, young adult, middle adult, or elderly? If a person is terminally ill, do they have the right to end their pain and suffering? Why is it okay for insurance companies to deny treatment to terminally ill patients, but offer physician-assisted suicide drugs instead?
The only 5 places that openly and legally authorize active assistance in dying of patients are Switzerland, Oregon, Belgium, Netherlands, and Washington State.
Senator Pat Thibodeau knows what it's like to watch someone die in terrible pain. Her husband Roger suffered from congestive heart failure and kidney failure for 6 years before he died in 2004. That's one reason why she's raising the issue in the Washington legislature. Thibodeau said, "I think people ought to have a choice in this matter." Pat Thibodeau's 14-page bill covers people who are extremely sick with incurable diseases. A patient must make a written request to want to die, and it must be witnessed by at least 2 people. At least 2 doctors must agree that a patient has an incurable disease and has 6 months or less to live and are of sound mind.
This is the Oregon Death with Dignity law. 4.5 pages, not very complicated as far as laws go. There is a form here that Brian would have to fill out. Request for medication to end my life in a humane and dignified manner. I understand the full import of this request, and I expect to die when I take the medication to be prescribed. It says I make this request voluntarily and without reservation, and I accept the full moral responsibility for my actions. And then he signs it. Once he signs it, there is a 2-week waiting period before the drugs are available.
Assisted suicide and death with dignity. Euthanasia, that is the act of deliberately ending the life of a patient, even at the patient's own request or at the request of close relatives, is unethical. This does not prevent the physician from respecting the desire of a patient to allow the natural process of death to follow its course in the terminal phase of sickness. Physician-assisted suicide, like euthanasia, is unethical and must be condemned by the medical profession. Where the assistance of the physician is intentionally and deliberately directed at enabling an individual to end his or her own life, the physician acts unethically. However, the right to decline medical treatment is a basic right of the patient, and the physician does not act unethically even if respecting such a wish results in the death of the patient.
Is physician-assisted suicide the same as euthanasia? No. Euthanasia generally means the physician would act directly, for instance, by giving the lethal injection to end the patient's life. Voluntary active euthanasia, when at the request of a patient, a physician administers a medication or treatment, the intent of which is to end the patient's life.
Oregon offers terminal patients doctor-assisted suicide instead of medical care. Some terminally ill patients in Oregon who turned to their state for health care were denied treatment and were offered doctor-assisted suicide instead, a proposal some experts have called a chilling corruption of medical ethics.
Wish for more time.
I'm not ready. I'm not ready to die. I've got things I'd still like to do.
Hope shattered with this letter from the Oregon Health Plan telling her we were unable to approve the cancer treatment. It will pay for comfort care, including physician aid in dying, better known as assisted suicide.
I told them, I said, who do you guys think you are? To say that you'll pay for my dying, but you won't pay to help me possibly live long. If there is a chance, if there's any kind of a chance at all, can we try it? Instead of just saying, no, you're not worth it?
Since the spread of his prostate cancer, 53-year-old Randy Stroop of Dexter, Oregon, has been in a fight for his life. Uninsured and unable to pay for expensive chemotherapy, he applied to Oregon's state-run health plan for help. The Oregon Health Plan in Lane County responded to Stroop's request with a letter saying the state would not cover Stroop's pricey treatment, but would pay for the cost of physician-assisted suicide. It dropped my chin to the floor, Stroop told Fox News. How could they not pay for medication that would help my life, and yet offer to pay to end my life? It's chilling when you think about it, said Dr. William Toffler, a professor of family medicine at Oregon Health and Science University. It absolutely conveys to the patient that continued living isn't worthwhile.
How would people be affected if assisted suicide is legalized? The practice of medicine would change because healing and killing would become equally valid goals of the medical profession. If death becomes a legal right, doctors will feel obligated to offer death as an option to all of their patients.